Hey, what's up everybody? I'm your guide, Billy Haley.
And I'm Tyson.
And today we're gonna show you how to use a chest seal. Let's go. I'm Billy Haley. Think of an injury and I've treated it. I've got over 20 years of experience ranging from the front lines of the battlefield to a hospital operating room. Teaching first aid is my passion. So before we get into the actual training, let's talk a little bit about where and when to place a chest seal. Okay? So, chest seal is simply an occlusive dressing. Occlusive meaning airtight, watertight seal. So when you have an injury in what I call the box, basically neck to navel, and that's all the way around, right? So my back, my sides, my chest, everything.
Okay.
If you get an injury, like a puncture injury, a penetration injury, something like that, it gets a chest seal every time, okay? They don't do anything to stop bleeding. Okay, so you're not gonna use this to try and occlude loss of blood or anything like that. You're not gonna put it on an arm or leg or anything. This is simply to stop air from entering the box area.
Okay.
Before we get into some of the training, what questions do you have?
I guess I don't understand why it's so important to block air from entering into the wound. I don't understand why that's a big deal.
So that's a good question. If you've got some kind of puncture or penetration, that air is gonna take the path of least resistance, meaning like if you inhale real deep, that air is gonna come in not just through your mouth, but it's also gonna come in that hole, that puncture wound. So we need to occlude that, right? We need to block that off. These have a great one-way valve on them, so air can escape that area, but it can't get drawn in.
Got it.
Okay? So, good question. What else you got?
When is a good time to use this? Is it after I clean the wound and after I have properly dressed the wound?
So you're gonna use this as quickly as possible, meaning you're not gonna just dress the wound and pack it and everything, because this is the first layer that goes over that puncture wound. This space in here, you can pack all day. It's not gonna do anything. That bleed is somewhere in here and you're not gonna find it. What you can do is prevent air from getting in there and potentially collapsing a lung, things of that nature. That's what the chest seal's for.
So before you put this on, do you clean off the area before?
Yeah, absolutely. So you'll want to wipe it clean. If there's sweat, blood, anything like that, go ahead and wipe that clear and then peel the back off, which we'll get to. I'll show you how that works in a little bit, and then you simply stick it on.
Okay. What if I come across someone that's got a massive chest beard? Do I shave him first? Here, let me get this, or what do I do?
No, you don't have to shave the patient's chest beard. So this is actually designed, it's got a super sticky back to it, which we'll see here shortly. And it's just, you clean off the blood, sweat, whatever, you just wipe that off, it just goes right over the top.
Very cool.
Yep. You ready to train on this?
I'm ready, let's go.
Cool, so here's what's gonna happen. One of us is gonna take our shirt off, the other is gonna apply this chest seal, all right? So, I will rock, paper, scissors you to see who takes their shirt off.
Okay, sounds good, you
All
ready?
right, yep.
Got you, dude.
No, that was slow, you can't
Take
do
your
it.
shirt off, you lost. Fair and
I'm
square.
telling you right now, that
Fair
was
and
not
square.
fair. That wasn't fair. What I'm gonna do
Okay.
is stick this little sticky thing right here. That's gonna represent the puncture, the hole, whatever.
Okay.
And this could be anything. It could be a gunshot wound, it could be a blast injury and shrapnel type injury, it could be a construction site, any
Okay.
kind of poke or puncture or penetration in that box area, okay?
Got it.
So we've got this hole here, right? So now air is entering this space. We don't want that. We need to cover that up with an occlusive dressing or an airtight dressing, okay? That's where the chest seal comes in.
Got it.
So go ahead and open that and I'm gonna talk
Okay.
you through how to put this on properly.
Okay.
Okay, up top here, you've got the little pull tab. There's
Okay.
no adhesive on that, so it tears apart real
So I'm good to
clean,
tear?
real easy.
Tear it open?
Yep.
Okay.
So, tear the backing off, that exposes the super sticky adhesive side, right?
Yes.
This little thing you're seeing with the 4 dots, that's that one-way valve. So air can get out, but it can't get in.
Okay. Ooh,
Okay.
Whoops, man, that's sticky.
That's okay. Yeah, it is real sticky. So, this little area right here, you're gonna
Okay.
center that over that puncture.
Over the chest. Okay.
So, you think you're just gonna slap that on?
Yeah, I'm ready. Let's
Or,
go.
what if I'm all bloody, right?
Oh god.
So, something to keep in mind. What are we gonna do?
Clean it off, right?
Right, so go ahead and just wipe it off. Anything around, grab it, use it.
Okay.
Right?
Sorry, man.
Gotta think outside the box. No, it's fine.
Your shirt.
It can be washed. Oh. You just took my wound. So, again, wipe it clean.
Okay.
Get that sweat off, get that blood off.
Okay, good.
Yep.
Okay.
Now, chest seal centers over that puncture right there.
Okay. And it doesn't matter where this is
It
facing?
does not matter at all.
Let's see here.
So get in there, slap it on. Yep, there you go. Good.
Is this
So
to make it sure it's on there really good, right?
Yep.
Because I don't want any air entering, right?
Correct.
Okay. And do I hold pressure, or what do I do now?
You don't need to hold pressure. You don't have to hold
done?
it for any reason.
Just
you
make
get the
sure
seal
everything's sealed.
Yep. Just make sure it's where it needs to be. It's stuck.
Okay.
It's sticking. It continues to stick, and you're good.
Okay, yeah, looks good.
So what happens now if I have multiple injuries in the box, like multiple penetrations?
Probably better hope I have more chest seals.
Absolutely. So if I've got more holes, more chest seals. If a person, especially with some kind of blast injury or certainly a gunshot wound, if they have an entrance, what else do you think they have?
Probably an exit.
Right, so there's gonna be at least 2 holes there, right?
Yeah.
So we need to get those patched up. You saw how small that package was, right?
Yeah.
I strongly suggest putting several in your first aid kit. Again, you might have several holes and you need to patch every single one of them. So they're super small, super thin, super light. Go ahead and put a bunch in your first aid kit.
Okay. Do I ever take this off?
No reason to.
No
right?
reason to, so I
leave
keep it
that to
on.
the next echelon of care. Leave that to the hospital. They'll deal with that. There's no reason to take this thing off.
Okay, sounds good.
Yep.
Thank you.
Cool. That's all there is to it, man.
Yeah, cool tattoos.
Thanks.
And I'm gonna be honest, like chest seals, like that stuff kind of scares me. Like, that's
Yeah.
a tough wound.
It can be a little intimidating, but don't let it throw you off. Get it wiped off, get the chest seal on, and you're done. You're
Yeah.
good. You've sealed that wound.
I do feel more confident being
Good.
able to apply a chest seal if I ever needed to be. So
Good.
that's thanks to you, man.
Yeah.
Appreciate it.
Thanks, man. Appreciate you.
Of course.
All right. Hey guys, thanks for showing up, stepping up your first aid game. I'm your guide, Billy Haley,
And I'm Tyson.
helping you stay alive.